In this video, I will be talking about few important chest X-rays which are important for MBBS final year examination. This is the normal chest X-ray PA view. PA view. Okay, so what are the structures that we can see in a normal chest X-ray? First of all, starting from the above, this blackish shadow is the shadow of trachea. This is one term is radio-opaque. Another is radiolucent. Radio-opaque means the X-rays cannot pass through these things, right? Like any hard object which are like bone, so they will appear white, and the radiolucent areas will appear dark. Okay, means while passing through air, this will be dark and the radio-opaque will be white. Okay, so trachea, it appears radiolucent, that is dark, it means there is air in the trachea. So this is trachea. These are the normal black means normal lung field, which you can write as lung field, radiolucent areas. Okay, these markings are known as bronchovascular markings. This is the right heart ball. This is the right side of the X-ray. This is the left side. Okay, our right is the patient's left and our left is the patient's right. This is the right heart border, which is formed by the right atrium. This is the left heart border, which is formed by the left ventricle. Okay, this is the aortic knuckle, which is formed by the arch of aorta. This is the right dome of diaphragm. This is the left dome of diaphragm. This angle is called costophrenic angle, and this angle is called cardiophrenic angle. This radiolucent or the blackish thing, it represents gas in the stomach or gas in fundus of stomach. This is also known as fundal gas shadow. Okay, this is lung field, this is clavicle, these are the ribs, and these are the spine. Okay, so this is a normal chest X-ray. Now we moving on to the different abnormalities. First is pleural effusion. Pleural effusion is very important from MBBS final year practical exam view. These are very important chest X-ray which are given exams, very common, right? So we can see that there is an, first of all, what we see, this is the right side, this is the left side. Another thing is that the lobes of the lungs. Okay, the right lung has 3 lobes and the left lung has 2 lobes. We draw like this. This is just to demonstrate the lobes of the lungs. Okay, this is the right upper lobe, this is the right middle lobe, right lower lobe, this is the left upper lobe, this is the left lower lobe. Okay, so we can clearly see that in the left lower lobe there is homogeneous opacity. Since there is whitish area, so these are radio-opaque, means the X-rays are not efficiently passing through these areas. Okay, it means there should be something either fluid or solid. Like, so there is fluid in the pleural space. So what we say that there is, first of all, how to identify that it is a chest texture pleural effusion. There will be homogeneous opacity, means there is no gap or in between the opacities. And second point is that there is obliteration of the costophrenic angle. If the effusion would have been in the right lung, then there will be obliteration of the cardiophrenic as well as costophrenic. Both angles would have been obliterated, right? So in this case we can clearly say that there is obliteration of costophrenic angle. In case of left lung effusion would have been in the right lung, there would have been, the answer would have been, there is homogeneous opacity as well as there is obliteration of both costophrenic and cardiophrenic angle. So this is a case of pleural effusion. Second is pneumothorax. Pneumothorax means there is air. Pneumo means air in the pleural cavity. Okay, hyperlucent lung fields. Hyperlucent lung field. Okay, this is the one point. Second is, see, there is no bronchovascular markings in the left lung. There are bronchovascular markings. These are the bronchovascular markings. So here there is no bronchovascular marking, no bronchovascular marking. So this is an example of pneumothorax, right-sided pneumothorax. Okay, hyperlucent lung fields and there is no bronchovascular marking seen. Second to third X-ray which we are going to is the hydropneumothorax. See, pneumothorax is common, right? There is hyperlucent lung field. That's the number one point. And the second thing is that this marking, see, it is quite above the normal left lung. Okay, it is quite above the normal left lung. Since there is a clear-cut marking, right? So it is clear that there is water. There is water in the pleural space. So clear cut, we can see that there is homogeneous opacity and there is clear cut level which we call as air fluid level. And one thing I forgot to mention, in pneumothorax as well as in hydropneumothorax, there is shifting of trachea. To opposite side. Clearly here also there will be shifting of trachea to the opposite side. So going to the, okay, this is clear, hydropneumothorax. There would be hyperlucent lung fields. There will be air fluid level, which is, this is air fluid level, and there will be shifting of trachea to the opposite side. So this is an example of hydropneumothorax. Coming to the fourth X-ray, is cardiomegaly. Cardiomegaly I have explained in another video also. In cardiomegaly there is enlarged cardiac shallot or cardiac shadow. That is, if we assume a midline, and take the maximum width on both sides of the cardiac shadow as well as the thoracic maximum width of the thoracic shadow to be C. If A plus B by C is more than 50%, if the cardiothoracic ratio, this is the cardiothoracic ratio, if the CT ratio is more than 50%, we call it cardiomegaly. Okay. Now coming to lobar pneumonia. The lobes of the lungs which I mentioned earlier are this is the right upper lobe, this is the right middle lobe, and the right lower lobe. This is the left upper lobe, left lower lobe. Okay, so we can clearly see that in the right lower lobe there is homogeneous opacity. There is opacity, but it is homogeneous in nature, as well as, so let us write one by one. There is homogeneous opacity of right lower lobe, as well as there is air bronchogram sign. What is air bronchogram sign? See, these are the bronchi. Okay, this is the trachea, this is the bronchi. So in this case the bronchi is prominent. Why prominent? Because of the inflammatory exudates, inflammatory cells, right? So they become prominent. The bronchi and the alveoli, they get filled with inflammatory cells, so they appear radio opaque in the X-ray. So this prominent bronchi, which is visible in the chest X-ray, we call it the air bronchogram sign. So it is positive, as well as there is homogeneous opacity in one of the lobes of the lung. So it is an example of lobar pneumonia, chest X-ray of lobar pneumonia. Going to bronchopneumonia, see there are some patchy, ill-defined, heterogeneous opacity. There are some opacity, but these are heterogeneous opacity, right? Heterogeneous opacity. And this is the case of bronchopneumonia in multiple lobes. This opacity is not fixed to any single lobe, right? In multiple lobe, in multiple lobes of lungs, in multiple lobes of both lungs. So it is an example of bronchopneumonia. Miliary TB. In this X-ray we can see that there are numerous tiny uniform nodular opacities, right? These are opacities. There are so many, numerous. So what we'll write is that numerous tiny uniform nodular opacities 1 to 2 millimeter in length, scattered throughout both the lungs, right? So it is an example of miliary TB. Then our next chest X-ray is a boot-shaped X-ray. This is a classical example of boot-shaped, right? This is the boot, shape of boot, right? This is a boot-shaped X-ray, boot-shaped heart, and as well as there is decreased pulmonary vascularity. See, the air bronchogram levels are not that prominent. So it is a boot-shaped heart, and that is decreased pulmonary vascularity. It is an example of tetralogy of fallot. The next X-ray is of Epstein anomaly. Epstein anomaly is a heart disease, is a congenital heart disease. Okay, so in this the heart appear globular in shape, also known as box shaped heart. If we keep a box like this, right, this is the box shaped heart. There is right atrial enlargement. This is important point because students might get confused between the boot shaped and the box shaped heart, right? So there is clear cut enlargement, very much enlargement of the right atrium. See, the right atrium is so enlarged, but in this case the right atrium is not that much enlarged. This is very enlarged. Okay, this is globular, this is globular heart. There is prominent right atrial enlargement in the case of Epstein anomaly. Now coming to another important is lung abscess. Okay, so in case of lung abscess, we can clearly see that there is a thick walled cavity. First of all, there is a thick walled cavity, what we are seeing at a first glance. Second, there is a air fluid level. Which indicate there is a pus filled thick walled cavity. It is an example of lung abscess. Second, the next X-ray is that aspergilloma. I have written earlier this point, important point. The mass which we are seeing inside the cavity, this cavity is also called as the mass is radio opaque. Why? Because it is white in color. Okay, this mass is white in color. It is a radio opaque mass. It is also known as intracavitary mass. Round intracavitary mass, and clearly look, there is a crescent shaped radiolucent area of this. Okay, so this we call as the ear crescent sign. Okay, ear crescent sign means there is a radiolucent area, crescent shaped radiolucent area. Okay, so this is example of aspergilloma, also known as fungal ball. Fungal ball is caused due to aspergillosis. Then our next X-ray is transposition of great artery. It is also an example of congenital heart defect. It is a pediatric X-ray mainly. So transposition of great arteries. This cardiac shadow appears like a egg on string. If we hang an egg, it appears egg on string appearance. We have to remember this. There is this Epstein anomaly, then transposition of great arteries, then tetralogy of fallot. These are similar type of X-ray. The most important is the tetralogy of fallot. The rest are asked very rarely. So it is an example of transposition of great arteries. Egg on a string appearance. There are some other points. There is increased pulmonary vascular markings, right? Then this is the classic snowman heart. TAPVC, total anomalous pulmonary venous connection, or 8 figure of 8 snowman heart.